Umbilicus is a normal scar in the anterior abdominal wall, and it is formed by the remnants of root of the umbilical cord. The position of umbilicus is variable, but in healthy adults, it lies in the anterior medial line at the level of disc between L3 and L4 lumbar vertebra. In infants, it is lower, and also in persons with the pendulous abdomen, umbilicus is comparatively lower to the healthy individuals. So, coming to the anatomical importance of umbilicus. With the reference to lymphatic and venous drainage, the level of umbilicus is a watershed. It means the lymph and the venous blood flow upward above the plane and downwards below the plane. So, they usually do not cross the umbilical plane. And the skin around the umbilicus is supplied by T10 of spinal cord. Umbilicus is one of the important sites at which the tributaries of portal vein anastomose with systemic vein, also known as the portocaval anastomosis. So you can see here that umbilicus is playing a role in the portocaval anastomosis. And in portal hypertension, these anastomoses open up to form dilated veins radiating from the umbilicus. Also known as caput medusae. But here, the point you should notice the blood flow in these dilated veins is normal and it does not break the barrier of the watershed line. Now, coming to the embryological importance. Umbilicus is the site of meeting of all the folds, that is, the head fold, tail fold, and two lateral folds of embryo. And during the embryonic life, the gap at umbilicus is known as umbilical ring. And umbilical ring gives passage to following structures. So, first one, midgut loop up to 12th week of intrauterine life, it produces physiological umbilical hernia. Later, this midgut communicates with the umbilical vesicle through vitellointestine duct. The next one through which it gives passes through the umbilical ring is allantois. Allantois is nothing but a diverticulum of embryonical cloaca. The proximal part gives rise to form urinary bladder, whereas the distal part obliterates to form the urachus. Umbilical vessels. Two umbilical arteries and one umbilical vein pass through the umbilicus to connect placenta with the fetus. Obliterated umbilical arteries form medial umbilical ligament and obliterated umbilical veins form ligamentum teres hepatis.